Hello, welcome to our coaching call on managing chronic pain naturally. My name is Jamie Stagg with the Great Plains Quality Innovation Network, and I am a pharmacist and quality improvement program manager on our medication safety and care coordination teams. The Great Plains QIN is the Quality Innovation Network quality improvement organization for Kansas, Nebraska, North Dakota, and South Dakota. We aim to achieve better health care, improved health, safer care, and lower health care costs. I'd like to welcome and thank our audience and speaker for their participation today. Today's coaching call will be recorded and posted to our website, www.greatplainsqin.org. Please note it will take 3 to 5 business days to be able to access the recording. After a short review of the January 9th webinar we had discussing managing chronic pain naturally, we will open the phones up for your questions. When we do that, you will need to push *6 to unmute your line to ask a question. Also, you can feel free to ask and post questions in chat on the webinar using the chat function on the bottom right side of your screen. We will be monitoring chat throughout today's webinar. Today's presentation, along with upcoming webinars, focuses on treatment of pain, one of the 5 pillars to address the opioid epidemic at a community level. Previous webinars discussed take-back programs and prescription drug monitoring programs. Recordings of all these events are available on the Great Plains QIN website. Today's objective is to simply provide an opportunity for open discussion, questions, and coaching regarding managing chronic pain naturally. First, let's briefly review the January 9th webinar. How important is non-pharmacological treatment in the management of pain? Well, it's very important. The CDC's guidelines for prescribing opioids for chronic pain lists non-pharmacological and non-opioid pharmacologic therapy as its first-line recommendation. These types of therapies and treatment should always be tried before opioids, and they need to continue to be used in combination if opioids are determined as necessary. Our presentation on the 9th did a good comparison of acute pain to chronic pain and really focused in on the challenges presented with chronic pain, and that is that evolution where that initial acute injury, it may not actually be the problem anymore when we get into chronic pain, and that it creates a wide variety of complex issues that are outlined on this slide and compensation that results in more issues. So it's kind of challenges beget more challenges with dealing with chronic pain. And we need to break that cycle and taking multiple approaches. There might be multiple strategies needed to be used, and it has to be, the cycle must be open to help manage that pain. And to highlight the importance that complementary therapies have in pain management is that pain is the #1 reason why people do seek alternative therapies. We also must keep in mind the power of the mind. The mind is good at anything you teach it. It has tremendous power, and it needs to be trained. That there is as much a component with that as there is with actual physical ailments when we look at pain management. On our webinar on the 9th, we looked at a variety of non-pharmacologic approaches. Our subject matter expert provided some great and quick background on a wide variety of techniques from sleep to meditation to yoga, use of nutraceuticals, music, herbal products, just a wide variety of therapies were presented. And I really encourage everyone to go back and review the slides and recording of that webinar, which are available on the Great Plains Quinn website. So that's just a real brief overview of that presentation. And now I'd really like to open things up to our expert in natural pain management, Dr. Jane Murray from the Sastoon Center for Integrative Health Care in Overland Park, Kansas. Dr. Murray, with more than 20 years of experience, has served in a variety of settings and is dedicated to transforming healthcare from the inside out. She has been the Director of Education for the American Academy of Family Physicians and is currently a co-founder of the Sastoon Center. What we will do at this time now is welcome Dr. Murray. Dr. Murray, thank you for joining us.
Thanks, Jamie. Glad to be here.
And now I'm going to change the conference call here over to question and answer mode. So now that we're in question and answer mode, it's time for us to begin a dialogue here today. So to speak, all that you need to do is press *6 on your phone line to unmute yourself. If you have any issues with that, you can also try and push *5, and we will add you to the queue and unmute you that way. And again, you can also use the chat feature to enter questions. So this is an open space, and at this time, I will open things up to see if we have any questions on the line. Okay. This is a chance for you to share your experiences if you have questions from the previous webinar, or if you wish to share successes or challenges you're currently having in your practice setting. Now is the time to do so. So what we can look at first here, Dr. Murray, is some questions that were asked and shared during the last call and in the evaluations that we had for the first webinar that you provided. So we have a few questions on that. I was wondering if you could provide some responses to those.
Sure. So this first one says, how do you discuss alternative treatments with patients looking for traditional opioids? So if somebody comes in with a chronic pain problem and all they know about is pain medication, it's an educational process at first, what's out there in terms of things that can be helpful other than opioids or in addition to opioids, that if they do have an indication. I ask people what their experience is with any kind of other treatments with massage therapy or acupuncture, chiropractic, any sort of gentle exercise or yoga. And, sometimes they've had some kind of an experience, or they say, oh, acupuncture, I hate needles, I don't want to try acupuncture. That's not uncommon. Then it's, again, sort of an educational experience to say, well, these are tiny little thin needles. They're not at all like the needles we give shots with or draw blood. They're flexible. They're not hollow, and they're really, really tiny. You can barely feel them even going in. So for some situations, acupuncture could be helpful, and it's not like the needles you've been used to with the regular medical kinds of needles we've used. So it's really just, and then maybe some of the information, the research out about how endorphins get changed with breathing, and meditation can really change the experience of pain. So, it's kind of a lot of education. I like to start also talking about diet, because if people are eating diets that are very high in sugar and processed foods and very low in nutrient-dense vegetables and fruits, they're likely to have more inflammation and therefore more pain. So an anti-inflammatory diet to me is really fundamental because it's something a person really can control, and it isn't something you have to have a prescription for or go to the pharmacy. But you have to, read and learn and get some recipes and have somebody help you if you're not interested in cooking or changing your diet. So it's a lot of education really, and asking questions what the person's willing and ready to do. What do you commonly see as some of the most effective and selected non-pharmacologic treatments was the second question. So I was thinking about this, and, I certainly do see acupuncture being very helpful for a wide variety of problems. The problem with it, of course, in most communities is that it is not covered by insurance and it isn't very cheap. So that's an obstacle for a lot of patients, is finding someone who's qualified and then having it, be affordable. So certainly stretching and yoga and deep breathing are things that are now pretty widely available in every community, and I see those being very helpful for a lot of conditions. Now, you have to be sure the yoga teacher is understanding of a physical limitation and doesn't have a person do a movement or a pose that is going to cause more discomfort and difficulty. But even just the breathing part of yoga can be incredibly great help. Meditation, there's no question. There's more and more research about meditation for chronic pain. That is totally free. You can get free meditation guides online. There's a good one called Headspace, HEADSPACE.com, that gives you 10-minute guided meditations, and it's really wonderful. You can get all kinds of audio downloads for that, videos, DVDs. So that would be a non-expensive and more research evidence supporting effectiveness. Certainly for a variety of conditions, there are herbal and nutraceutical supplements that can be helpful. Turmeric and curcumin, they're the same plant, are very effective for inflammation in many situations. Depending on the pain problem, I actually just read an article this morning showing a lot of good evidence for migraines using the herb called butterbur, which is a member of the daisy family, but it is has, again, a lot of evidence to support prevention of migraine headaches. So some of the supplements, some of the nutraceuticals can be helpful. Staying flexible, moving, not becoming inert and immobile and stiff. So gentle swimming, gentle water aerobics, walking, keeping moving is incredibly important, because when we have chronic pain, we think, oh, that hurts, I shouldn't do it. Then we get more deconditioned, more unable to move, less flexible, and that just worsens the situation. So those would be some of the most effective non-pharmacologic treatments. We talked a little bit last time about how important sleep is for being able to have resilience, to manage pain and deal with it. So being sure sleep hygiene is good, and the sleep quality, dark room that's cool, bedtime rituals that get you relaxed, no lighted screens, reader books, or computers, TV for two hours before you go to bed. But a regular book would be fine. Calming herbs, lavender, a warm bath. Typically, interestingly, for relaxation, you want to take a bath, not a shower. Showers can be a little stimulating, actually, and a warm bath is more relaxing. So all of those good, typical sleep hygiene practices. I'll probably think of more in a minute, but good resources for additional information about herbal and over-the-counter products. One of the best, most reliable resources, I think, is a website called consumerlab.com, all one word, consumerlab.com. And there is a small fee for a subscription to this, but they have no support from industry. The nutraceutical industry, the supplement industry does not pay for them to review their products. their sole support is this subscription service. So they're really totally, free of conflict. And they will take a product, let's say fish oil, and test in a lab 50, 30 different products, brand name fish oils, and tell you what does the label say is in it, what's actually in it. Are there any additional toxic products in there, mercury or other things that shouldn't be in there that could be harmful? They'll do multivitamins, they do various herbs, and every monthly edition of their newsletter has multiple new evaluation sections, and then they have a whole encyclopedia of their prior reviews. So you could go in there and go, well, what's a good Butterbur product? Who's got something that's exactly what it says it is and the exact milligrams that it says it is and doesn't have excipients and other ingredients that are harmful. So to me, that's honestly one of the very best resources for this type of supplement. So,
excellent. Thank you. We have had a couple of questions asked in chat. We're not very talkative here on the phone lines today, but we're getting a few things on chat. And again, a reminder to everyone, if you want to ask a question over the phone, please press *6 on your keypad to unmute your line and talk. And feel free to interrupt us at any time with a question. One of the questions that we had in chat is, how would you suggest alternatives to patients from a pharmacy standpoint?
So I'm guessing a pharmacist might be asking this question. So from a pharmacy point of view, I know more and more pharmacies in our area, even, regular, not even specialty pharmacies, but CVS and Walgreens are having natural products on their shelves. And one of my colleagues who trained at the local pharmacy school and did a fellowship in nutraceuticals, actually, she's working in a commercial pharmacy and became the person that picked out which brands of which supplements they would be offering in that pharmacy. So I think pharmacists can certainly be a wealth of resource for patients coming in with questions, or patients who are picking up prescriptions, and maybe ask the pharmacist, what else could I be doing? I know there's all this opioid worry, and, what are some other things I could try? So becoming a little more familiar with some of these alternative nutraceutical therapies could be helpful. I don't know if that's what the questioner wanted to know.
Yep. Well, we can ask that individual that entered that question in the chat to please either enter a follow-up question or response in the chat, or again, feel free to use *6 to unmute your line and ask a question. We also had a request in chat to provide a little bit more information on diet and inflammation.
Okay. One of my favorite topics. So it turns out, that there are foods that are considered anti-inflammatory because they promote pathways of biochemistry, to lower the inflammatory response. And then there are other things we eat that increase inflammation. And this is monitored through, whether something has a high antioxidant index, an ORAC index, ORAC. Oxygen radical absorption capacity is how antioxidant power is measured in foods. So, for example, some of the foods that have the highest ORAC scores are blueberries and pomegranate and highly colorful, dark, pigmented fruits and vegetables. So those things tend to have more anti-inflammatory effect because they are also antioxidants. Fish oil is an anti-inflammatory substance. So eating fish and taking fish oil as a supplement can be helpful in reducing inflammation very, very, very powerfully. foods that are more inflammatory because they create an immune inflammatory response as well as more free radicals and what we call reactive oxygen species are things like sugar in really almost any form. So refined white sugar, brown sugar, raw sugar, maple syrup, molasses, you name it, agave even, things, all of those things that are sugary in terms of not being a sugar that's in a food like in a fruit. Those things create a lot more inflammation, and it turns out that if people who have pain, whether it's fibromyalgia or arthritis or chronic muscle pain, any kind of chronic pain scenario, and they just cut sugar out of their diet, added sugar, they are always surprised at how much better they feel, how much less aching and joint pain and restricted movement they have. So sugar would be my number one inflammatory food to try to limit. Now, for many people, I think gluten is another offender. There's a lot of, maybe fad issues about, I got to be gluten-free, got to get gluten-free food. But it's true that the wheat that we grow today, and I know many of you live in the wheat belt, has been, hybridized to the point where it has no gene in common with ancient wheat. So, and it's for reasons of, making it easy to harvest, and more gluten makes better baked products. We like the taste and the feel of foods that have more gluten because they keep things held together. If you've had a gluten-free cookie, you know that it just kind of falls apart. It's kind of grimy and gritty and doesn't hold together very well because it doesn't have the glue of gluten. So our wheat today has about 40% more gluten than it did even 20 years ago, which is probably why we're seeing more people with sensitivities. So in many recommendations for people who want to reduce inflammation, we recommend that they go sugar-free, gluten-free, and you're going to love this being from the Midwest, dairy-free, because milk products for a lot of people create some inflammatory response, kind of an allergic reaction where the immune system is put on high alert. So those would be the three big food categories to think about minimizing: food, sugar, gluten, and dairy. And then for some people, for example, nightshade vegetables, tomatoes, potatoes, green peppers, eggplants, any kind of pepper, actually. For many people, those foods tend to be more inflammatory. Now, sweet potatoes are not potatoes, so they're okay. They're a different category. But there's even some evidence that people who have osteoarthritis of the hands have a little more trouble with tomatoes than people that don't have this problem. And it turns out I actually have osteoarthritis, and I do have it in my hands. And I eat salad every day. Love the greens, get all my colors. It's fabulous. I was always putting tomatoes in it. I thought I would see, does this make a difference? I left tomatoes out for about a week, and my goodness, my fingers felt better. So that's just an N of one, but there is a lot of evidence about nightshades for particularly arthritis. Red meat for some people can be more inflammatory. And so sticking with poultry, fish, if you're going to do beef, then grass-fed, and you want hormone and antibiotic-free of all of these, whether it's poultry or beef or veal or eggs. So more anti-inflammatory foods, we said fish oil, vegetables, and you want a rainbow of colors. Let's say you happen to like spinach, but that's the only vegetable you eat. You got to get yellows, you got to get reds, you got to get oranges, you got to get blues. So you need to go beyond just the green of spinach, although it's a great vegetable with a lot of nutrients in it. You need really to think about, I tell patients, think about getting 8 to 10 colors in your diet every day, a rainbow of colors, and maybe a handful, about half a cup of each color. So some berries, with your breakfast in the morning, and then a salad with 5, 6 different colors in it, a couple handfuls of greens and chopped carrots and chopped cucumber, and I'm just thinking what's in my salad today.
How long will it take?
How long would it take to eat this way to feel better?
Yes.
Is that your, yeah.
if I avoid all this sugar, dairy, and gluten, how long will
Yeah.
it take for me to feel better?
Well, I'll tell you, I do a 10-day sugar detox with patients who want to see about getting off sugar. So you can definitely feel better in 10 days. And your craving for sugar often goes away if you really avoid it conscientiously for 10 days. When we do something with people a lot called an elimination diet, where we give them instructions to avoid all these foods I've just mentioned, but then list the foods they can have. And we do that for 21 days. And I would say I've had almost no one who hasn't felt better after a 21-day elimination diet. And then, you could add things back one at a time and see if that causes a problem. So 10 days, I've seen really good results, particularly with sugar. The full elimination plan, 21 days, and then see how you feel. And I really am very always impressed at how well that works for people. So it doesn't have to be like a year. You want some quicker results than that.
Yeah. Well, for many of us Midwesterners, that would be a big ask to do
I
that.
know.
So,
I know. I'm sitting here in Kansas saying, boy, I am an iconoclast for us all in the Midwest. I know.
But I mean, that's good that you can see those quicker results, and that can aid in your motivational interviewing and shared decision making and all that, I'm sure.
Yes.
We've had some chat is picking up here with some questions, so I'll fire these off to you here quickly. So the pharmacy question, we did get some follow-up comment on that the person asking the question is a long-term care pharmacist, and they have many residents on opioids and would like alternative suggestions for physicians and residents. And so along those lines, I'd say what are those suggestions, and then how would you recommend making the suggestion? Because I think that's also sometimes a challenge I can say as a pharmacist that we sometimes have is getting those recommendations accepted. Sure.
Well, there's actually a lot of work coming out. I'm reading articles and hearing from my colleagues in pain management that people on chronic opioids actually sometimes have less pain if we reduce their opioids. Mm-hmm. So, and that, of course, has to be done carefully because you don't want somebody to go through withdrawal. But I've had the experience of gradually reducing somebody's like MS-Contin or OxyContin, lowering the dose over time slowly, and they do not suffer from more pain. They actually are like, I think I feel somewhat better. So seeing if there is a way to very slowly taper, and I think physicians would be very open because, usually I think we're all getting very concerned about the problem of opioid overuse, addiction, and so forth. Now, there are people who legitimately need pain medicine. There's no question about that, and we've been in trouble in past decades for undertreating people's chronic pain. But I would start with something like turmeric, like an anti-inflammatory herb, turmeric or curcumin, 500 to 1,000 milligrams twice a day, as maybe the opioids are being slowly withdrawn. Most people in nursing homes are seriously vitamin D deficient. They don't get out in the sun. Their vitamin D does not occur in foods. And so unless a nursing home resident is taking a vitamin D supplement, I will bet you almost any amount of money their vitamin D level is very low. When vitamin D is low, people feel awful. They have pain. They're tired. They're depressed. I have seen nursing home residents with vitamin D levels of, 9, should be 50 to 70. You get them on some vitamin D, and they're like a little new person. They're sitting up. They're perky. Everything's better. So I would definitely recommend people, if you can, get your physicians to check vitamin D levels and get folks' level up to at least 50, 60 nanograms per deciliter. And then that could go a long way. Think about tapering the opioids carefully, adding turmeric The other supplement that I think could benefit just about everyone and does help inflammation is the fish oil. So something like, and what you want to do is you want to look at the EPA and DHA content on the label, which is not on the front. You'll see a bottle at, somewhere, Costco. Fish oil, 1,000 milligrams, you think great, but you turn it over and you look at the EPA and DHA content. That's what you want to have be 1,000 to 2,000 milligrams a day of those two added together. And so that often will take either a high potency version, a liquid perhaps, or multiple pills to get to that level. But fish oil is, again, something that most people are sort of deficient in. Does that help, Jamie, you think?
Dr. Mark?
Yes.
Yep. Go ahead, ask your question.
I have a question.
Go ahead.
Go ahead.
You mentioned about turmeric. I thought turmeric was very hard to absorb, and then you have to have like an adjuvant to use that's supposed to be incorporated in the manufacturing of turmeric to be able to absorb it in your system.
There is some evidence that you need an extract of black pepper in order for turmeric to work optimally.
Yeah.
And that may be true. I've also read some articles that have disputed that. So I don't know that it's absolutely essential. I mean, people have benefited from plain turmeric and curcumin for decades. And this addition of the black pepper extract to make it more beneficial, I think, is a newer idea, and there's nothing wrong with it, but I don't think it's an absolute. Like, if you can't get turmeric with this black pepper, don't even bother. I would definitely bother. I would definitely try turmeric.
I always thought that turmeric was very hard to absorb, like to digest or something like that.
Well, anybody in the audience cook Indian food? It's in everything.
Okay.
It's a wonderful herb. In fact, that's a great way to get it into your system is the powdered herb you can get at specialty stores in many big cities, and then just put it in everything.
Okay. We have reached our time, but if you have time, Dr. Murray, for a few more questions, if people need to leave, we can always you can always refer to our recording. Would you have a few minutes for a couple more
sure
questions?
do. Yeah.
Okay. We have a question here about do you use essential oils? If so, which brand and how do you use? And do you support aromatherapy for inpatient use?
I do not have a lot of experience with aromatherapy and essential oils. I have colleagues that are very, very experienced and find all kinds of ways to help people with essential oils. And there are a few hospitals actually in the country that are doing some integrative medicine programs with inpatients. I believe there's a big one in Minneapolis. I'm trying to think where else in the country, but it has no harm. There's no downside really to essential oils or aromatherapy. And sometimes patients who are very sensitive to drugs, like people with fibromyalgia, often even supplements, medications, little doses send them off. But aromatherapy is very mild and can be really helpful. Lavender is a wonderful, relaxing herbal. Valerian is a wonderful muscle relaxant. But I'm just not that literate in the specifics of essential oils. I'm sorry.
Okay, that's fine. Thank you. And here's, I think a question that healthcare as a whole in this country is dealing with right now. That's been posed to you, so it's a big question for you here.
Okay.
The question is, how do we have that conversation with our patients about pain management when our culture basically has been to teach patients that they should be pain-free in the hospital. We're getting away from that and telling them to expect pain and that we might need to try, these alternative options to reduce opioids. Where do you suggest starting that conversation?
Wow. Yeah. How many hours do we have? Well, I think it's a very important question, and it's a tough one. And, if you're talking about in the hospital and somebody's had surgery and so forth, of course we want to minimize their pain, and we have really good ways to do that. But when you get beyond the acute pain phase, and now we're into chronic pain for which there isn't that acute event anymore that's really negotiating the pain with your nervous system, now it's how your brain is responding to and receiving pain messages. So that's the little education about how the brain has changed now with this chronic pain problem, and that opioids, while sometimes helpful, may also actually be somewhat harmful. And like we talked about a minute ago, that lower doses, sometimes people have less pain. Trying these other things that help people manage pain, deal with pain, accept pain, and coming to the realization that with someone that has significant chronic pain, the goal cannot be being a 0 on a 10 scale. What is your pain now? It's 8. Okay, that's not acceptable. That's terrible. But if you could be at a 4, you could be at a 3, 4 most of the time, that might be doable. How do we get you there? And so that is a long conversation, and it's hard in our, we want a quick fix society. We want a pill for everything. We don't want to have to change our diet. We don't want to have to exercise. We want to be thin. We don't want to have, pain. We want, that's a tough one. That we just have to have serious conversations with people.
Yep, and that is a great answer to a difficult and excellent question. I didn't want to belittle that question. I didn't mean to come across that way. It's a great question that we're all dealing with, and that was a great, as concise of an answer as you could provide to that. We do need to start to wrap up here, so I just wanted, Dr. Murray has graciously shared her contact information for any follow-up that people might have. I want to encourage everyone, a week from tomorrow, we have the next webinar in this series about a family medicine residency clinic that has implemented some chronic pain management programs, as well as some webinars coming up in March and April around a statewide pain guidance document developed in Nebraska. And this is not just for people in Nebraska. Others could be interested in learning more about this as well. And you can also feel free to contact any of our medication safety and care coordination experts at the Great Plains Quality Innovation Network for additional assistance as well. Dr. Murray, again, I thank you so much for joining us today, and I thank all of our participants for joining on the line.
Thank you, guys. Have a great week.